It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with your own aging and care plans. Our topic today is why dental implants are not always the best option. And joining me to discuss this topic is Dr. Lee Sheldon. Welcome, Dr. Sheldon.
Well, hi, Joe.
Mind if I call you Lee?
Please
Okay.
do. Yes.
You know, it's interesting, Vera, because something is happening in Dr. Sheldon's life that he is an extremely competent dentist, periodontist, and dental implant person, and he's capable of surgery. He can do so much, but I think it's something that's happening in his life. But he is now doing something to become a teacher to help other young periodontists that want to do some of the things he's done. Do that. Am I correct?
It's very exciting because,
but that's true, though.
It's I've always liked teaching. I taught at the University of Florida for a number of years. I've always tried to incorporate teaching into what we did in our office, and now we're teaching periodontists around the country things that they can do to help their practices and help their patients.
It's importantly because I saw a man that some of his teeth were actually falling out because of periodontal disease. Yep. And if it would have been caught in time, it never would have happened probably. The chances are, even now, as advanced as it is, if it's treated, it might be able to save some of his teeth. If not, he's either going to have implants or dentures, and this man probably will never be able to afford implants, so have a set of dentures.
Yeah, and unfortunately, there are certain assumptions that are made, and that's the reason why we're doing this topic today.
Right.
There are certain assumptions that are made, and the certain assumptions are that you have to have your teeth extracted and something else. And let's go back 30 years ago. We had denture mills, big denture mills in different parts of the state, different parts of the country. So people assumed the teeth couldn't be saved. So the automatic answer was take out all the teeth and put in dentures. You know, there's a denture mill there are denture mills now, but you know what they're called? They're called dental implant centers. And so instead of having the cheap dentures made, we have expensive dental implant therapy done instead. And now, you know I do a lot of dental implants.
I know that.
So I'm not against dental implants. But when the patient starts to say, I'm assuming that my teeth need to come out, I'm sick of dealing with the teeth, I'm going to go to the dental implant center and have all the teeth taken out and have dental implants put in, well, that may be necessary. And it's a great service if it is. But frankly, there are a lot of people right here in Brevard County, as well as all over the country, that are assuming that because they've had some difficulty with their teeth, that they need to have the teeth out. And whether we take the teeth out for dental implants or whether we take the teeth out for dentures, we're taking the teeth out. And you know what? You don't always have to do that.
Well, I know that. And Dr. Sheldon I'm going to ask him to describe the situation, folks, because roughly 2.5 years ago, I had a stroke. And I was very fortunate. My mouth was not twisted. I was able to continue to talk and continue to do my radio and TV shows. At times, if I'm not careful, I slur my words, and my wife reminds me to be careful not to do that. But I certainly, I am not really truly impaired by my stroke, but most people are. They have severe strokes. They have, and you described a perfect situation. And I would like for you, if you can, no names or anything like that, but describe what was presented to you by a daughter and a father and what you, because it illustrates what some of the things we're going to talk about later.
It is. So here's the situation. As you know, I have a full service practice. Even though I'm a specialist, my son's a general dentist, and so we can do a lot of things other than the surgery and the periodontal treatment.
Right.
So the father was a stroke victim, probably at least 75 years old. I forgot how old he is. And the daughter brought the father in because the father had some loose teeth and some teeth that were decayed. And she wanted to see me not for anything else other than for us to do dentures for her father. Now, he still had his teeth. And so I did what we ordinarily do. We do the examination, we do the x-rays. And Joe, his teeth weren't beautiful. And frankly, he had ignored his teeth for a long period of time. But he'd been to another dentist and he'd been to a specialist, both of whom said the teeth needed to come out and he had to have dentures. So she was seeing me, bringing him to me for the dentures to see what my part of it would be before the teeth were extracted. He had, let's say, 20 teeth, about 10 on the top, 10 on the bottom. Only one of those teeth can't be saved. Every other tooth can be saved.
Through periodontal treatment.
Through periodontal treatment, through adjusting the bite, and through taking care of the decay, doing the fillings that need to be done. Simple fillings, not big crowns or anything like that.
And your son can do all that.
And my son can do that. Now, picture this patient, because this patient had very little lip control and almost no tongue control and almost no jaw control, meaning his jaw was like this. So he's moving around like this during the examination. There's no way on earth with somebody who moves his lips the way he was and moved his tongue the way he did and had no jaw control, there's no way that we could make dentures for him.
You couldn't get an brushing.
That's right. And he couldn't wear the dentures because his lips are all over like this. So instead of having his teeth, which are anchored to bone, he has this big plastic thing on the upper and on the lower. He wouldn't wear them. So he'd be gumming his food for the rest of his life. It's disturbing because had the daughter brought her father, and she did, brought her father to a periodontist, periodontists know how to save teeth. And so I told the daughter that, listen, we can save the teeth. We don't have to go through dentures. He's going to lose one tooth in the front, in the lower front. You know, if you care about that, we can bond a tooth in, but he's not going to care about that. And we can take care of everything all in one visit. And he'll never, and he won't have to have dentures. I said, you know, the chance he may lose one or two teeth sometime in the future. He may. But right now, he doesn't have to lose anything but one, and he'll be able to chew. And, you know, he won't have to think about his mouth again. So that's what's disturbing.
I can understand as a dentist with the skills that you have, I can understand your concern. And when I ask you about, we did this show on radio.
Yeah.
And when we talked about what we want to do on TV, you suggested that we do the same show because, yeah. But in a way, you're putting the dental profession on report.
Well, in a way, I'm putting the dental profession on report, I suppose. But as you know, I think that patients or potential patients need to understand that a periodontist is not somebody that you necessarily have to wait for your general dentist to refer you to, because that may never happen. And here's an example of a patient seeing two dentists, including a specialist, and who had periodontal disease, and never was there any thought or any consideration about referring that patient to a periodontist.
I cannot understand, just as a lay person and not skilled as a dentist, but based on all the radio and television I've done over the years and all the research I've done, I can't imagine two dentists not recognizing the fact that the man had had a stroke and would have not control of his mouth, how they would hope to do what they're proposing. I don't understand how they can do that.
I don't either. And frankly, I don't, except this part I do know. I really think that many dentists don't know what good periodontal therapy can accomplish. That there are too many assumptions made that because there's too much decay and there's too much periodontal disease, there's nothing that can be done. When in fact, a good, competent periodontist can do a lot to help a patient keep his or her teeth. And teeth that we assume need to be extracted don't need to be extracted. But periodontists are trained that way. That's why we go to school for as long as we do, to be able to give the patient all of the options. Saving teeth, if in fact it's practical. Extracting teeth and putting dental implants, if in fact that's practical. So when you're seeing a periodontist, it isn't just, I've got gum disease. You're seeing a periodontist because a periodontist is trained in diagnosis and treatment planning and predictability. And frankly, periodontists need to be taken advantage of more often by the patient. And so patients come into periodontists all over the country for diagnosis and treatment planning so they can get a full picture of the situation and then make decisions on how best that person should be treated.
I may be partial to saying that I understand what you're saying because I've been working with you now 2007, 5, almost 11 years simply on writing and radio and TV work.
Yep.
That's a long time. And all the research I've had to do and having you work on me with some implant work, and I went to you because I trusted you to do the right thing by me. I've had absolutely no problem with the implants you put in my lower jaw. And I'd had some work done there that I had there for 30 some years. I don't think it was, that just, my bridge, in fact, it was time for it to be replaced.
It was, but some competent dentists had kept on working with those teeth. And you had a lot of good dental care that was done in order to keep those teeth going. Now, if you had to keep those teeth going by having to repair it every 6 months or every year, that doesn't make any sense. But here, you were able to keep these teeth going for what? It was like 20 or 30 years before we finally...
years.
How long was it?
35.
35 years before we went to the next step. Dental implants. Yeah. Okay, that was the time for you to go to dental implants. At that point, when I looked at it, I said, Joe, everything that could be done has been done. Now it does make sense to do dental implants.
And see, this is the point that I think a lot of people fail to understand. That they think that when a person gets old, I use the word old, 82 going on 83 is old. It's not getting older. I am old. My teeth are in fairly good condition, and I brush and I do all the things I'm supposed to do, except go to the dentist, get them cleaned as often as I should. And I don't have time to do that anymore.
Yeah.
But, there are certain things in life you give up to do other things.
You're right, you do.
But just because a person is older doesn't mean that they don't want or should not want to have the right things done to their mouth.
Yeah.
I don't know how much longer I'm going to live, but I enjoy my food. I enjoy eating. I love going to Panera's. I love the broccoli cheese soup at Panera's. And I could probably eat that without my teeth.
You're right.
But seriously,
yeah.
What you're saying today is, look in the mirror and look at your mouth and say, be honest with yourself. If you've got a problem, you can see it most of the time. You can tell if you should go see a periodontist.
No, actually you can't. Because there are times,
you're right. Okay.
If you wait for the teeth to get loose, then often it's too late for periodontal treatment to help.
That's right.
But the bone gradually melts away. But still, if you have 50% of your bone is still pretty tight. And in periodontal disease, of course, the problem is loss of bone support. But the loss of bone support has to do with accumulations of bacteria on the teeth. And frankly, unless you see a periodontist, you're not even able to look at the bacteria from all of the different perspectives we look at bacteria. We probe, we sample, we send a sample of bacteria out to the lab to find out what's there. We do non-surgical treatment. We do surgical treatment. There are a lot of things that go through a periodontist's mind before we do treatment. There's a lot of diagnosis that needs to be done. And so sometimes the patient's assumption is, well, I went to my dentist and I had deep cleanings done. Guess what? Many of my periodontal patients went to a general dentist and had deep cleanings done. But you can only clean so far below the gum line before you can't feel what you're doing. And so there are things that periodontists can do to get into the deeper pockets to clean those areas effectively. Whether it's antibiotics, whether it's the periscope that we use, whether it's laser, whether it's surgery, there are things that we can do in order to be able to help a patient keep his or her teeth. So just because you have the assumption that you had periodontal treatment in your general dentist's office, and that's all that can be done, and therefore the next step is extraction, that's absolutely not true in many, many cases. All right, the general dentist did as much as he or she can. That doesn't mean we're all done. It does mean now go to the periodontist who's trained to treat advanced diseases and can help you save your teeth.
The example that you gave pointed out a rather extreme case. And I'm going to correct myself because I should have known better than to say that, because actually the best treatment really is to get teeth cleaned about every 6 months.
Or 3 months if you have advanced disease.
You mean I sit there and have them go down below my gums every 3 months?
I'll be so gentle with you, Joe. But actually, listen, you're 82 years old. I know your situation, and you're doing fine the way you're doing. You don't. When I see my patients and we do active treatment, I like to see them 3 months later and to make sure it's stable. And if it's stable, then we spread out the cleanings to every 4 months. And if it's stable, we'll go to every 6 months. Different patients need different levels of help. The better most people take care of their teeth at home, the less they need me for maintenance. And so part of it is training you to do what you need to do at home, or patients to train you how to do what you do at home, and to make sure that we take care of what we know how to do in order to be able to keep you from losing that tooth.
But now, because other dentists recognize what you have done here in Melbourne and Brevard County, they're coming to you for instruction.
Well, I'm providing business help because the business model that we have is different than most periodontal practices around the country. And because we've created a business model, which includes a treatment model. After all, part of our practice is wellness.
Well, you do periodontal care, general dental care, and implants.
Correct, those are the procedures. But we also have Lisa, who's a nutritional counselor. She's a certified health coach. And so, there are things that we can do for ourselves, for our entire bodies, that will make us better. Well, if it makes our entire bodies better, guess what else is going to be better?
Better teeth.
Yeah.
Does Lisa recommend Juice Plus?
Yeah, yes, she does.
I just got 2 boxes of that stuff.
Yeah, and your daughter is making sure that you take it, right?
Yes, she makes sure I don't take it as often as I should. I got a crick in my neck today, and that's not caused by a dentist or anything else.
Okay.
But I want to just glance what we were talking about here, right? You had a comment I wrote down. Dental implant centers, and I think that we could call them mills, we could call them anything we want to say, but I think we have to be very careful wherever we go to get treatment. I'm not sure how to say it. I don't want to say it the wrong way. But I think that just because somebody can advertise they can do something, and when you start when you start drilling down to the bone, I can see horrible things when you drill coming out on the side of the jaw. I can see going too deep if you don't have the right equipment. I know what you have in your office and how you, with your drill and with the continual scan, you can see what you're doing.
Yeah.
Do all these dentists that advertise implants, do they have that same equipment?
Some do, many do, and some don't. There is, this is changing, but there was no defined specialty called dental implantologist. The American Academy of Implant Dentistry is actually creating a method by which general dentists can be certified in implant dentistry. So I'm not saying you need to see a periodontist for dental implants, but if you go to a cardiologist in the United States, every cardiologist goes to medical school first and then goes for cardiology training second, and then finally can call him or herself a cardiologist.
Right.
We're not at that level in dentistry. We're not. And so there are some inroads being made in order to be able to require that, but that's not there yet. If you say you can do a dental implant, you can do a dental implant. And while the standard of care today, for example, needs to be, in my opinion, and I think my opinion is being accepted broadly, it's not something where it's just coming from me, you need a CT scan in order to be able to place an implant correctly. So there are CT scanners, there are mobile units that will come to a dental office in order to be able to allow a patient to have a CT scan taken if the dentist doesn't have his own CT scanner, or you can send a patient out to another dental office, such as mine, where a CT scan can be taken. Yet, and the reason you need a CT scan is because you want to see the bone three-dimensionally, because you're drilling a hole in the bone three-dimensionally, and you need to know where that hole is going to be.
Yeah,
well, for the first 20 years of my career, or maybe 15 years of my career, I was drilling blindly, or I was doing it not blindly. I would have to reflect the tissue back far enough so I could see where the bone was, so I knew where I needed to drill. Today, I'm able to treatment plan everything on the CT scan, so I know if the patient has an altered configuration of the bone isn't exactly the way it should be. I can tell that. I can see that in advance. And so the more the technology that we have and the better we can use the technology, the easier it is for the patient. And so you want to go to somebody who has that kind of technology available to make sure that it's being done and it's being done correctly. But still, I'm going to backtrack to our original statement. Our original statement is, don't be so quick to extract your teeth when in fact they may be able to be saved for a longer period of time, predictably, and make things look beautiful. I can't tell you how many times each year people come into my office because I'm the dental implant guy, and they say, I want my teeth extracted and have dental implants done. And I said, no, you don't need that. Here's all we need to do. Can probably do it at half the fee, a third of the fee, a quarter of the fee, and you're going to have your teeth and you'll like them. Don't do it. So I want people out there, you out there, I want you to understand that diagnosis needs to be done first. Just because I have a beautiful ad and because you see beautiful ads on TV does not mean that's the only option for you. And by the way, contrary to what we say in the advertising, dental implants can have problems too.
Yeah, I know that. Every time I've hit you on a TV show, I sit there and I grind my teeth, wondering if my bite is really right.
Yeah,
and I think of every time I've done a dental show with you, I always get you ask you to tell our viewers the importance of a good bite.
Yeah,
and that can solve. It can alleviate so many other problems in your head if your bite is right.
It could be. But understand that there's some things that can make your bite bad, and it isn't just your teeth. If you said you have a crick in your neck today.
Yeah.
For a significant number of people, if they have a crick in their neck, it means the muscles are tight here. These muscles are indirectly connected to these teeth here, or to your jaws, and so your jaw alignment shifts a little bit because your neck is out. And so now you may be biting harder on your right side than you are on your left side because your neck is the problem. Chiropractor or physical therapist may be able to help you better with your bite than I will.
I always, after I talk to you, I feel like I have to go get something fixed. But it is important, Lee, that people understand that. Well, one question I had: are we starting to give up our teeth too easily or too quickly?
Well, and that's really the topic. We are starting to give up on our teeth too easily, and we're saying there's this panacea out there, dental implants. Once I have my teeth extracted, put in dental implants, I'll never have a problem again. Guess what? As I said, dental implants can have problems too. You need to floss and brush dental implants just like you need to do natural teeth. You need to go to your hygienist for professional tooth cleaning just like you do your natural teeth. And by the way, if a tooth goes bad, it's easier to make that tooth better than if a dental implant goes bad. It's more difficult to make that dental implant better.
I don't even want to think about any problems with my dental implants.
Good.
Just
come to your periodontist a little bit more often, Joe. What do you say?
I brush them. I should brush them more, but and I do. And my wife and I both keep dental floss right by our chair.
Good.
But we're almost out of time. Is there anything else that you might want to say?
No, I think we've made the point. I want everybody, I want viewers out there, I want you to understand that the periodontist is somebody you can see by yourself, and I would encourage you that if you have a complex dental problem or if you have periodontal disease, go see a periodontist.
Okay. I'm not going to let you talk again, because if I let you talk again, we'll go over time, and I can't do that.
Okay.
But I always enjoy having on the show because I think you make a couple of good points for our viewing audience. It's extremely important. And I want to thank you for Dr. Sheldon for being on the show.
Thank you, Joe.
Thank you. And I want to thank you, viewer, for watching today's episode of Helping Seniors. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.